Casey Tan is a doctor at Garfield Medical Center. Dr. Tan specializes in minimally invasive surgery. Recently, Dr. Tan gave a patient perhaps the best gift a doctor can give, utilizing state-of-the-art technology available at Garfield Medical Center, including the ARTIST-Z Biplane imaging system. Dr. Tan was able to save a young mother's life.
We had a 34-year-old lady who came in for a cesarean section delivery on Mother's Day. After the delivery, she had postpartum hemorrhage that was massive. Her hemoglobin counts dropped significantly, and her life was in danger. So I was called by the OB, the obstetrician, to consider an embolization procedure or a minimally invasive procedure to try and save her life. She was initially taken to the operating room where they had tried to perform a hysterectomy to remove the uterus in an effort to save her life. Unfortunately, because her blood levels were too low, she was in a state of what we call disseminated intravascular coagulopathy. They were unable to remove the uterus because she was bleeding too much. So they sent her to the ICU. She was unstable. Her blood pressure was crashing. Her pulse was crashing, and she was about to lose her life. That was when we decided to go in. So we took her to the cath lab, the biplane machine, biplane room, and performed an embolization procedure. We took a catheter through a keyhole incision in the right groin, and we placed this catheter in several of the blood vessels that were bleeding, identified on angiography, and we embolized these blood vessels. Once we were successful, her blood count started to rise, and we managed to save her. She became more stable. The benefit of this procedure was that it is minimally invasive, so there was only a tiny incision in her leg, and she managed to preserve her uterus. So she survived this. It was Mother's Day. She gave birth to a healthy baby girl. She has her uterus intact, and she's young, so if she desires to have more children in the future, she could absolutely do so. You should be going to go home very soon. You have your uterus, so if you want to have more babies in future, you absolutely can.
Thank you so much, Doctor. I will send the baby picture to you.
That would be very nice. Thank you. Thank you very much. Thank you. The team that we have here at Garfield, they're a wonderful team. They are first class. Everybody knows their part. And the reason why we have successful results is because everybody knows what to do and when to do it. We do it fast, we do it right. Instead of having big cuts in big places, we do small cuts in small places and achieve the same or even better results. Cancers these days can be treated with catheter-directed therapy, where we place a catheter directly into the cancer to deliver chemotherapy and avoid the systemic side effects of the chemotherapy regimen. Carotids can be revascularized with stenting and angioplasty. We can save feet from amputation by restoring blood flow, and we can pull clots out of people's heads when they have a stroke. So these are some of the advancements in endovascular surgery and neurosurgery that have changed the landscape of medicine today. Given the COVID pandemic, I understand that there are some concerns with coming to the hospital, but there are some medical conditions that can be life-threatening that should not wait. Stroke, obviously, cancers, folks with renal disease requiring dialysis. These folks still need to continue their follow-up regimen and to come to the hospital in a timely fashion so that the disease processes are well controlled and they can continue to stay healthy despite the COVID pandemic. This is a patient in his 50s with intracranial hemorrhage. The patient has a hemorrhagic stroke, and we're performing a diagnostic cerebral angiogram to determine what the cause of his stroke is and if it's amenable to any form of neurointerventional surgery that could help him could help us secure hemostasis for him.